we continue to see essentially a wave of cases happening with COVID. I want to give you some numbers for you to just kind of understand the gravity of the situation that we're in. The number of COVID hospitalizations, and think of hospitalizations, I may have used, I think I have with you, used the analogy before, as the tip of the iceberg that is above the water. It takes a heck of a lot of sick people statistically for one person to be in the hospital, okay? And so when your hospitalizations have gone up 88% for COVID here in Dallas County in 24 days, since the first of this month until today, we're up 88% in this county, okay? So that means that that part of the iceberg that's under, for this thing to dang near double up here, that base of sickness of the iceberg under the water that you can't see is increasing exponentially. And we're seeing that. We're seeing that one of the fastest growing groups of people that are sick with COVID are people 18 to 39 years old. And you say, well, isn't that a good thing because don't they have a better chance of survival? Well, they get real sick. We've got them on ventilators. You know, there are some very sick young people right now with COVID. And as you know, we've had some that have died from COVID. But what else we know about young people is they're more social. They're working the jobs like waitressing and working at the grocery store where they are bumping in to a lot of people. And then a lot of young people are more social, so they're going out with friends. And the more you're around people, particularly when you're not wearing a mask, the more it spreads. And so we've got a situation today where we've seen skyrocketing numbers in the whole state over the last 4 or 5 days, and we're going to have to take some actions to control that. I'm asking the governor to do several things. I'm asking them to look at the Open Texas document and look at those requirements in the Open Texas document. Those things like spacing of work stations and those things like putting people to work in shifts so they're not all together. All the things that he's talking about in there that he's making recommendations to make a lot of those requirements. And I'm asking that they look at things like bars. I mean, folks, do we really need to go to a bar right now, given that the situation that we're in? Not to close all businesses, but to look at the businesses where I'm asking him to do it, but I'm asking you to do it until he does or unless he doesn't. Look at businesses where you cannot go to the place and wear the mask all the time, or your fellow people there aren't wearing the mask all the time. So if you're going to a spin class where everybody wears the mask into the room and then takes off the mask and pants and breathes heavily for an hour, your breath is traveling about 10 times farther and you're expelling a lot more volume at the spin class without your mask on. So maybe there's a different way to exercise for now during the surge. And the bar, please stay out of the bar. And there are other examples of this. Anywhere where you're going and people can't wear their mask all the time, just don't go there. And we need to work very quickly. Another place where I'm asking for the state to come in and help, but I want you to take a stand on it as well, is we've seen a big increase, the beginning, statistically big, but the beginning of an increase in kids getting sick at daycare. And remember we had that conversation, I was criticized quite a bit for having a conversation with you a few weeks ago when we just started to get cases in nursing homes. And I said we have to have a difficult conversation, and if there's a way to get folks out of the nursing home, you may want to consider that. And people, understandably, a lot of people with hurt feelings. And I understand for a lot of people, there's just not an option, right, to take your loved one out of a nursing home. And similarly, there's not an option to take your child out of daycare. But here is an option for us. I'm asking the governor to make this a rule, but mamas, we know how this works. You can make it a rule. Make sure your daycare is masking all the kids over 2 years old, okay? Make sure that your kids are staying in their group and not playing with the other groups. Make sure that the kids aren't using playground equipment that other groups are using. Make sure that the kids aren't eating in large congregate or group settings with other groups where they're taking their mask off and all breathing, on one another. These are some ways that we can keep our kids safe. I'm asking the governor to quickly put those into orders, since they've taken away our ability to do that when he took this over in May. But you can do it right now, Mom and Dad, by just talking to the other parents at the daycare and making sure they're doing these things. All right. We have seen the number of cases go up 62% since the beginning of June. And of course, some of that may be due to testing. But we've also seen that go up. If we want to go exactly a month ago, so 30 days, it's gone up 136%. Some of that's due to testing, but the hospitalizations are not due to testing, and we've got a lot more sick people out there, so we need to be a lot more careful. Dr. Wong will have some more information about the spike in ER visits for COVID when he speaks. I want to talk to you about our federal testing request and what's happening with the test sites now. We're working with our congressional delegation. I know both of our senators are working on this, bipartisan. All of our members of Congress here are working on this, and we've made a request. And here's our request to the feds. In the face of what has become a second wave of COVID, we just cannot afford to lose any of our testing assets. We need to dramatically expand testing. We're seeing so many more people line up for tests that people are waiting hours sometimes to get a test, because when we get there to the sites in the morning, there are hundreds of cars at 8 o'clock ready to go through, and we run out of kits before the day is over. Okay, so we've got a vendor on the ready, so that if nothing happens with the feds at an expense to the county and the city, we can keep going with what we have. But what we need is to keep going at a greater capacity, because we have more sick people, we have more people getting tested. And so here's how we could do that. We talked about this a little bit before last month, but nothing came of it. At Parkland, we have a machine that can test 1,500 COVID tests a day on a 1 to 2 day turnaround. But we don't have the reagents, the chemical, to run that machine. There's similar machines at University of Texas Southwest, or UT Southwestern, that can do about that many, about 1,440. So we're asking the feds, hey, don't spend the money on your lab anymore. Just give us the reagents to do it for ourselves, because we can get it done faster. We need that faster turnaround time that helps us in fighting COVID. We need that faster turnaround time, and also we still need the nasal swabs, which are in short supply. We need those things, and then we can do this. It saves you money. It makes it better for us. That's the partnership we're asking for. If for some reason you can't do that, then the partnership that we're asking for is keep doing what you're doing. We'll use our vendor and our CARES money to do other locations and continue to expand. Either way, and I'm very hopeful that will happen. Each time, the way these negotiations work is, for some reason, it ends up being at the last minute when we get things done. We're a week out. I'm really hopeful that we'll get this done soon rather than the day before, the 1st of June. But at any rate, or 1st of July rather, but at any rate, that's where we are. Now let's talk about what's going to happen with the American Airlines Center. That will be moving to the University of Dallas in Irving. Now, if we don't work out a deal with the feds to get more federal assets, and we're using CARES Act money for the city of Dallas and the county of Dallas, then the only people that will be able to get tested at our facilities will be people who live in Dallas County. This is because the CARES Act money must be spent on the people in the jurisdiction where the CARES Act money was sent to. And so if we don't get those federal reagents and those federal test kits, you'll need to take some proof beginning on July 1st that you actually live here. That doesn't mean you need a picture ID. A water bill, a utility bill, anything that shows that you live here can get you tested. But if we don't work out a deal with the feds, we will not be able any longer to service people from other counties. We will have additional information about other new locations, and we'll have we'll get you information about the hours and whatnot at the University of Dallas. And I want to thank the City of Dallas for the partnership, but also I want to thank Irving for their help, and of course the University of Dallas and the diocese for their help on that. We're going to partner and have 3 additional walk-up testing locations that are currently open, and whether we work our deal with the feds or not, our vendor will have these open. Those are Redbird Mall, Inspired Vision Church, and Sam Tasby Middle School. That's Vickery Meadows area, right there. You can look it up on Google, but it's right there where the roads meet. Okay, now let's talk about mass gatherings, because I know we're coming up on the 4th of July. The governor has given authorities to county judges and mayors to limit mass gatherings. I've asked our doctors, led by Dr. Huang and others, to look at this and give advice. We'll have an order on the Commissioner's Court for an emergency meeting, and don't have that done yet. But well before the 4th of July, probably a meeting on Monday if I had to guess, we'll have an order that will limit crowd size, but will have exceptions for the things that are protected by the Constitution. And I'm also trying to work with our partners at the state level on exactly how far that can go. But we'll have information on that. So what does that mean for today? You're saying, Judge, you're going to do something, but you're not telling me what it is just yet. Well, it means if you're planning something big for the 4th of July that is in excess of 100 people, you just need to be aware that there will be a order presented to the Commissioner's Court, and probably similar orders presented to city councils throughout Dallas County that will restrict that crowd size. We've had people that tell us that it's hot in Texas and the mask is hot, or they're having trouble breathing with the mask, not while they're jogging or whatnot, but just they have trouble breathing with the mask, and that's a reason why they don't want to wear it when they go to the grocery store. Well, some people truly do have trouble breathing. They're on oxygen. They carry it with them wherever they go. But I would just ask those of you to remember, because it is uncomfortable wearing the mask, but it's a slight discomfort compared to the discomfort of a ventilator. And although you're feeling discomfort and your mask is itchy or tight, so are all the other people's who are masking to protect you. So please do your part and mask to protect them. I want to also give a special shout out to the town of Addison for taking special precautions in light of the growing COVID-19 spread. Even before the governor allowed us to control crowd size, they have moved their annual Kaboom Town fireworks show to an online television display. In just a minute, I'll be turning it over to Dr. Huang and Dr. Brett Moran with Parkland to discuss the new automated contact tracing system that we rolled out on Monday. This is an exciting collaboration, and it's going to help supplement the hundreds of healthcare heroes who are currently working to do the best they can to keep up with tracing. And that's quite a Herculean effort on the part of these folks. Each person who is sick averages about 10 to 12 contacts that need to be traced, okay? So you can imagine, we started off with a system that dealt with like syphilis and tuberculosis, other communicable spread diseases that require contact tracing. Well, there's not a lot of that. So the 16 to 30 employees that worked on that normally could get to that. And then suddenly you've got 30 COVID cases a day, then 50, then 100, then 200, then 300, and a week later, then 400. And with each of those cases, 10 to 12, and sometimes a whole lot more, if they got it at a larger gathering. And so they're doing everything they can to keep up, and this program is going to help them.